Hello, and thank you for following me. Today we're going to talk about the quality of healthcare that you receive when you're on Original Medicare, or when you're on a Medicare Supplement, or when you're on a Medicare Advantage plan. Is it different? Do you get different care at a doctor's office or in other places at a hospital based on the type of insurance that you have? Personally, I've helped over 1,000 people with their Medicare. My company's helped over 60,000 people with health insurance and Medicare. So I'm going to give you my thoughts around this very important and sensitive topic. I'm going to come at this from the angle of there is a good plan for everyone, and there's a reason for every plan. So if you're a Medicare Advantage hater, don't stick around because you're not going to like this video. If you're a Medicare Supplement hater, don't stick around. You're not going to like this video because I'm going to talk about how the care can be better in some situations on each plan type. But listen, I can't please everybody because some people just can't be pleased, all right? I'm going to do my best to give you unbiased information and my honest assessment about the care on these plans. So let's start with Medicare Supplement plans. People who really are concerned about access to doctors and who have the money to afford that access by paying a monthly premium for their Medicare Supplement plan, in addition to the premium that they're already paying for Medicare Part B, they choose Medicare Supplement plans because they want that freedom. And one of the things that people say about Medicare Supplement plans is that I can go to any doctor anywhere. Hold that thought because it's not true. I can go to any doctor anywhere. I can go to any hospital anywhere. And I never have to do prior authorizations. Well, listen, when it comes to Medicare, beware of definitives, definitive statements like I never, I always, I can. Those never seem to work out because there are caveats to everything. First, though, let me say that the default is with the Medicare Supplement that you can usually go to most doctors, that you can usually go to most hospitals, that you can usually have a service performed or have a procedure without prior authorization. Notice that I said usually because there are some caveats to this. Let's talk about doctors first. Some doctors only take Medicare Advantage, and it depends on where you live. For example, in places like South Florida, Texas, South Texas, Southern California, notice I'm saying all the southern states, Las Vegas, Nevada, Phoenix, Arizona, some of these places, there are medical groups that only work with Medicare Advantage. And so in those cases, you cannot go to those groups with the Medicare Supplement plan. For the most part, specialist groups, hospitals, specialty groups, those sorts of things, typically will accept Medicare, original Medicare, with a Medicare Supplement. But some of the specialty primary care clinics, think of some of the ones that are specifically built for seniors, the ones that are built for people with Medicare. Many of those, and particularly up-and-coming ones, only take Medicare Advantage. But for the most part, you can go to most doctors, most hospitals with a Medicare Supplement plan. So I wanted to put that caveat out there. What about the caveat that there's no prior authorization on Medicare supplements? Well, I'm sorry to break it to you, but there is a new program coming in 2026 that will have prior authorization, and I made a whole video about it. If you haven't seen the video, then watch that on my channel. I'll leave a link for you. But there are 5 states doing a pilot program right now, starting in 2026, that you will have to have prior authorization even with original Medicare and a Medicare Supplement for some procedures and for skin grafts and some things like that. So it's not everything, but be careful of definitives because they don't always work out. But with a Medicare Supplement plan, pretty much you can go to any doctor, any hospital, etc. Does that equal better care? Well, that's the question that I'm trying to answer in this video. Do you get better care if you can go to almost any doctor and almost any hospital and if, with your Medicare prescription drug plan, almost any pharmacy? Well, the answer is yes, and the answer is also no. It can be yes and no. There are people who go to lots of doctors and end up with problems because of something I'm going to talk about called coordinated care. Medicare Supplements and Original Medicare, no coordinated care. Medicare Advantage, coordinated care. I'm going to explain why this can be a big plus for Medicare Advantage, but it can also be a downside of Medicare Advantage, and why it can be a downside of Medicare Supplement, but can be a plus. So the pluses and minuses on both sides. Okay, with the Medicare Supplement plan, no coordinated care. What does that mean? It means that unless you're going to doctors that talk to each other, or doctors that are part of some network or group or something like that, they don't know what is happening at the other doctor's office. So you can go to 5 specialists. Those 5 specialists they could even be from the same specialty. They could all prescribe different medication, and they don't know. No one's talking to each other because there's no coordination of care. This is one of the big gaping holes of original Medicare with the Medicare Supplement plan. So if you are not within this a network of some kind, if you didn't stay with a doctor and a specialist that know each other or that are part of the share information or share medical records, they don't know. And so you could be prescribed something that's a mix match. Now, if you go to one pharmacy, you'll probably be okay because that pharmacy will catch that and say, wait a minute, this specialist prescribed something and that specialist prescribed something, and they should not be taken together. But you could go to a different pharmacy. I know people that are like, oh, I get this one medication over at Costco and I get this other medication over at Walmart and I get this one over at Walgreens. I would say don't do that. Have one pharmacy because that can catch some of the issues that the lack of coordination of care on a Medicare supplement can cause. Now, okay, so that's one example, medications. Here's another example. With a Medicare supplement, you have to be in control of your own health, which is most people want a Medicare supplement to be in control of their own health. But consider that there may be a time in your life when you won't be in control. And if there's no coordination of care, that could be a problem. So here's an example. You go into the hospital. You have a heart attack, let's say, knock on wood. So you go into the hospital with a heart attack and you come home. When you get home, you call your primary care doctor. Now, there are some caveats to this. If your primary care doctor is associated with that hospital, there's a possibility, maybe, that they will know that you've been hospitalized. And there's a possibility, maybe, that your specialists, which as you get older, you'll have many, know that you're hospitalized. But in most cases, they won't know. They won't even know that you were in the hospital because there's no coordination. So what coordination is, it's behind the scenes. Something is happening. Communication is happening between providers meaning doctors, between hospitals, that they're talking to each other about you. That's coordination, that they are working together in a coordinated effort to improve your health. That does not exist on typical Medicare supplement and original Medicare coverage. There isn't this coordination behind the scenes. There are things happening behind the scenes that you may not be aware of. For example, there are networks in original Medicare that most people have no idea exist. They're called ACOs, Accountable Care Organizations. And so you think, oh, I can go to any doctor I want. So what do? You go to your primary care doctor and you say, hey, I really want to see a specialist about my knee pain. And he says, oh, I'll tell you the very best guy in town. Because listen, I hate to say this out loud, but just because it's a doctor doesn't mean they won't fool you or lie to you. How dare I say that, right? I mean, in this society, we hold doctors up like the holy of all healthcare, right? Is a doctor. I'm sorry. I've been working in the system long enough to know that there are good doctors and there are bad doctors. Okay? If that's a revelation to you, I'm sorry. So the doctor says, oh, the best guy in town is Dr. Jones. He helps people with their knees and whatever else. You got to go to Dr. Jones. You have to. I mean, I wouldn't go anywhere but Dr. Jones. Well, guess what? Dr. Jones is part of your doctor's Accountable Care Organization, or ACO, and you didn't know it. You thought you're free to go anywhere. Well, your primary care doctor is keeping you in a network, an invisible network that the government has set up and condoned called ACOs. I'm not going to go too deep here because I'm going to do a whole video on ACOs. But the point is that your doctors are together in a hidden network that you don't know of, and they're referring you within that network. And if they keep you within that network, then they get to share in the cost savings that they saved. So there may be a better specialist in town for you. It's actually Dr. Smith, not Dr. Jones, but your doctor is going to tell you to go to Dr. Jones because if he does, he'll make money. Your primary care doctor will make money because your specialist is in the ACO. Millions of dollars. Revelation. I'll do a whole video on it, I promise. So what I'm telling you is that with original Medicare and a Medicare supplement, you may not have or may not be accessing all the freedom that you think you are. Is it worth paying for? Of course. Of course it's worth paying for. It's amazing to have that control. But is there a downside? Yes, and I'm pointing out the downside that there's no coordination happening behind the scenes. So if you get to a point where you can't coordinate your own care and you can't keep track of all of the things that are happening in your health, which is going to happen as you age, then you need someone who does. You need a child, a spouse, a loved one, someone who is watching out for you and coordinating things for you, because that's not going to happen for you behind the scenes. if you're on original Medicare and a Medicare supplement. Is it still worth having? Sure, of course. Medicare supplements can be amazing, but you have to coordinate your own care. Okay, let's switch gears over here and let's talk about Medicare Advantage. With Medicare Advantage, is there coordinated care? Yes. And most people hate coordinated care because they only hear referral to specialists, prior authorization, and those are the downsides, and I'm going to talk about those downsides. But there is coordination of care happening on Medicare Advantage. Does it mean you should run to a Medicare Advantage plan if you have a Medicare supplement? No. I'm trying to teach you so that you understand the differences, right? And how they all work so that you can make a choice for yourself. And I'm not invested in convincing you of one path or the other. I want to help you to realize, what the ups and downs are of both sides. And not just because, especially here on YouTube, there's so much garbage. There's so much talk about how Medicare Advantage bad, Medicare Supplement good, Medicare Supplement great, Medicare Advantage the devil, right? So no, it's not like that. I want you to understand the positives and negatives. So I'm going to focus for a minute on a big positive with Medicare Advantage, and then I'm going to point out how it also is a double-edged sword with a negative. So the big positive is that Medicare Advantage, this is my Medicare Advantage world, this is my Medicare Supplement world today. So in the Medicare Advantage world, there is coordinated care. And that means that when you go to the doctor, it is in their system and they're coordinating it. And it's interesting that medical groups are not great at this. Medical groups are good at providing specialties and doctors. They're not good at coordinating care. They're not good at communicating behind the scenes. They don't want to spend the money to have people who do all that coordinating. They just want to see you, prescribe you, send you on your way. I'm sorry. Sometimes I get frustrated with our modern medicine. But in Medicare Advantage land, your plan, the insurance company, hires the people that coordinate your care. The insurance company is paying for nurses to see what's happening in your world and to keep track of you and to communicate between specialties and to make sure that you're taking your medication. So they're looking at things like, hey, your primary care doctor prescribed a medication. Did you fill it at the pharmacy? Are you adhering to it? Are you taking it? Adherence, which means taking the medications that are following the treatments that are prescribed, is a big problem. A lot of people don't adhere to what their doctor has prescribed. So someone behind the scenes from the insurance company is watching those things and keeping track of those things. That's managed care. In this world, in the managed care world, if you go into the hospital, everyone is going to know. They're going to be alerted. If you're in a good managed care program, not all of them work the way they're supposed to, right? But if you're in a good managed care program, a good Medicare Advantage program, then they're going to know. Your primary care doctor is going to know. Your specialists may know. They're going to make sure that you don't get readmitted to the hospital. And this is why KFF.org, which used to be called Kaiser Family Foundation, KFF.org found that fewer people are readmitted to the hospital when they have Medicare Advantage. If you have original Medicare with a Medicare supplement and you come out of the hospital, you are more likely to end up back in the hospital uncured than if you have a Medicare Advantage plan. Why? Because when you go in the hospital, alarm bells go off at the Medicare Advantage insurance company. Alarm bells because they know something is wrong, and when they find out what's happening in the hospital, they usually have hospitalists, which are doctors that work in the hospitals, and they find out what's happening with you. Again, this doesn't always work the way it's supposed to. I'm talking about the theory of it, right? And then when you get home, then they reach out to you, they find out what happened, they get you an appointment to your doctor. They're providing behind the scenes assistance with your plan because they don't want you to go back in the hospital. That's what a good managed care program is. Now, what is a bad managed care program? Well, unfortunately, because of all this coordination that I'm talking about, managed care sometimes is a pain in the butt. I'm sorry, I had to say it. It can be a pain because, first of all, in order for this to happen, you start with your primary care doctor. You need a referral to see your specialist. So referrals, people don't like referrals. Oh, I'm waiting on a referral. You need prior authorization. Oh, I'm going to need prior authorization to go to have that CT scan or that PET scan. Well, yeah, PET scans are, by the way, are very, very expensive. I think more people should be talking about how expensive a PET scan is. I mean, if I can get an iPhone that is like a powerful computer, more powerful than the computers that took spaceships to the moon, then why does a PET scan cost so much? I think it's inflated. Anyway, I get on a tangent, but the cost of healthcare is a problem. A bigger problem than the cost of insurance, because insurance is just a reflection of what the cost of healthcare is. So it's very, very expensive. A PET scan's expensive. You're going to have to do prior authorization. So I thought, how bad can prior authorization be? I grabbed a list, and let's talk about this. This is from a Medicare Advantage company. This is a pre-authorization list that they have of 7 things I want to show you. So first, a PET scan. What do they need? Well, they need the requesting physician's records. You don't have to provide this stuff, but your doctor does. And this is part of the reason why a lot of doctors, they don't like to do this. There are a lot of doctors that say, oh, just get original Medicare with a supplement. I don't like all that. Why? Because this takes work on their part. They have to justify stuff. And I'm not blaming them, but I understand the reason for it. Let's look at number 6, bariatric surgery. Bariatric surgery is a big deal. It's very expensive. It can be, and if you're on Medicare and if you're a senior, it can be very risky too. So what do they want? Well, they want the recent surgeon's office notes, which include height, weight, BMI, and diet history. What if your doctor sends his notes, but he doesn't include your BMI? Well, it's going to be denied. And when a prior authorization is denied, everyone loses their mind. And it's frustrating, right? And they get denied. The average is somewhere around 2 out of 10 are denied. And then when they're appealed, then almost all of them will go through. But, that's a frustration with managed care. And I don't blame people who say, I don't want to deal with prior authorization. I just want to have full control. Well, good for you. Pay for a Medicare supplement. We can help you do that. That's fine. And pick the right one, pick the right company, all of that stuff. You won't have to deal with that. But the one thing that you give up is the communication behind the scenes. And I'll tell you, there's almost no one here on YouTube that's going to tell you that there's some positive to managed care, but I'm giving you the frank, honest truth. There is a positive. I knew someone who was getting very old. He was my client, and he was 80 years old, and he was beyond the point where he could manage his health care. I'm telling you, it's better for him, and it was better for him to be on a Medicare Advantage plan. All of a sudden, someone was contacting him when they found out he didn't fill his prescriptions. That would never happen on original Medicare. I'm telling you that it extended his life to have that type of managed care. Now, before everyone starts screaming at me, I'm not telling you that you should join a Medicare Advantage plan. I'm just pointing out to you that for people who are in the situation where they can no longer manage their own care, which is a lot of people as they age, there's a lot of positive to having managed care. And sure, jumping through hoops, which we call prior authorization, which by the way isn't as much yours to jump through as it is your doctor, but your doctor doesn't like to jump through those hoops. I get it. That's a frustration. But as you get older, managed care may not be a bad thing. So I hope that you found this helpful today. If you're still trying to figure out, hey, what is the difference between Medicare Advantage and Medicare Supplements? I made a full video on that, so I would say watch that next, and I'll see you next time.